Imagine inclusion. What does it look like, feel like, and sound like? Is it a program, a space, a code, a policy, or attitude? My work asks people to reimagine inclusion through a spatial justice lens. My work focuses on the promotion of an inclusive culture globally through design, advocacy, capacity building, and through influencing citizenship behavior. I am Dr. Janice Rieger, an associate professor here in the School of Architecture and Built Environment at QUT, and I'm regarded as a thought leader who shapes new inclusive theories and methods. I'm a theme leader in the Design for Health with the QUT Design Lab in Design for Aging and Abilities. In this focus area, we collaborate with partners and with people with lived experience of aging and disability to improve their health, well-being, and their quality of life. I lead local and national international teams across diverse sectors to create cultures of inclusion. With universities, like here at QUT and other universities, to create inclusive programs, policies, and curriculum. With federal and local governments, both here in Australia and in Canada and elsewhere, to create access audits and develop inclusive policies. With clinicians and healthcare teams to create just access to healthcare. And with museums and galleries globally to create inclusive exhibitions and programming. I'm inspired every day to make the world more inclusive through the experience of growing up with my grandmother who was blind. She inspired me, and from these early childhood experiences of seeing our world as ableist and ageist, this inspired me to make a difference and design for all. In my research over the last decade, I have examined the significant gaps in research and practice of inclusion. I started to reimagine inclusion and map the exclusionary systems of different organizations. In the past couple of years, I have worked with over 30 different partners. I co-create disruptors. I bring together diverse communities to co-create together things that disrupt ableist systems. Things like films, houses, exhibitions, technologies, we've even created some animations, and augmented reality simulations. These disruptors are different for every project and unique to every community. My work is grounded in collaboration and specifically co-design, and I use creative practice to co-create inclusion with vulnerable populations to create just access for all of us. Recently, I employed this collaborative design method for a research project with Queensland Health. I was lucky enough to work with a large team from QUT Design Lab, Queensland Health, and Clinical Excellence Queensland, and we designed several projects that were recently awarded 2 National Good Design Awards for social impact and service design. The project that I led with Metro South Health and the partners there was about increasing the uptake of interpreter services to create just access to healthcare. We did some research and realized that patients in Queensland Health that were culturally and linguistically diverse were not receiving the just access to healthcare that they needed because they needed access to interpreters. And so we mapped this problem and we came together to collaborate and to create 3 co-designed animations that were really amazing to be used by clinicians and to educate them about the importance of using interpreter services to create that access to healthcare for their culturally and linguistically diverse patients. My work and the projects that I get the honor to work on challenge dominant ageist and ableist bias, and I create inclusive ecologies that enable rather than disable.